for coming out. It's lovely. All righty, good morning. I'm Dr. Soleil Arrieta. I'm the Integrative Family Physician here at St. Elizabeth's, and today we're going to talk about a holistic approach to chronic pain, what that might look like, how we can start to manage our pain, maybe with different things and different modalities and therapies that we haven't heard of yet. So let's first talk about pain. A lot of providers or physicians will talk to you about whether your pain is acute or chronic, and what does that mean? So acute pain has a rapid onset, right? I walk out to my car and I twist my ankle. Now my right ankle has a lot of pain, swelling, inflammation. That is acute pain because it's lasting just a short amount of time. Now most people, and about 60%, have acute pain for less than a week, right? The ankle heals, I get better. Now a little bit more than that, 60 to 90% of people will recover from their pain in 6 weeks. And 95% of people recover in 12 weeks, so 3 months. Now, if you are unfortunately part of those 5% of people that still have pain longer than 3 months, that is now chronic pain, right? It is lasting much longer than anticipated, and we should be done with the healing process, so therefore the pain should be done, but we're still experiencing some lingering pain. That is now chronic pain, and you can have chronic pain either intermittently, which means it comes and goes, or all the time, constant pain. How is acute pain treated? Now, if I go out and I twist that same ankle, I'm going to probably, stay off of it for a little bit, but stay active. I don't need to put it in a cast, but I'm probably going to elevate it, put some ice on it. Maybe as it starts to heal, put a little bit of heat if that makes it feel better. Using over-the-counter Tylenol or non-steroidal anti-inflammatories like ibuprofen, naproxen, which is Aleve, Motrin, all of those medications that we can get. I can also go to my doctor. If the pain is severe enough, I might say, hey, I think I might need it adjusted. I might go to my local chiropractor. I might see my local osteopathic doctor who also does manipulation and manual therapy. Or I could consider physical therapy, right? My right ankle has been giving me trouble for years and years, and it always seems to be weaker, and I always tend to sprain it. So let's see if physical therapy can help me strengthen the muscles and tendons around that joint, so hopefully I don't have this continue in the future. Chronic pain is a little different, right? If pain is lasting longer than 3 months and it is an ongoing issue, so then we have to kind of look outside of those things that help us with the acute pain and look elsewhere. How else are we going to treat our pain? Now what's interesting is that in the last 10 years, and I have 4 statistics up there, Medicare shows a significant increase in spending specifically for chronic pain. And it says that we increased the epidural steroid injection, which is steroids straight into that back, and this is specifically for low back pain. But I use this as an example because low back pain is a very significant portion of people with chronic pain. But this is very similar statistics with, rheumatoid arthritis or other arthritis in other joints, fibromyalgia, chronic headaches, etc. But we've also seen an increase in opioid expenditures by 400%. Now that increase in the epidural steroid injection actually went up by over 600% just in the last 10 years. There's an increase in a lumbar MRI, and that means that lower back. So just taking an MRI of that lumbar has increased by over 300%. Now imaging gets kind of tricky because studies have actually shown that if we take imaging of our lower back or spine in adolescents, right, young people that tend not to have pain, we're finding abnormalities in their spine that's not causing them pain. So now it's the chicken and the egg, right? Am I having the pain, and that's why I'm getting the imaging, but the imaging shows me that something's wrong, but that could have been there since we were a teenager, and it's not actually causing the pain. So it's a very interesting conundrum and problem that we're running into. We're using a lot more of our resources and money in imaging that maybe not be warranted, right? So it's very important to talk to your physician about that. And we've increased our spinal fusion rate by over 200%. Now, spinal fusion is when you go see a spine surgeon, and they will fuse some of the vertebrae or backbone muscles together so they don't move independently anymore. And this is sometimes needed in severe chronic back pain, or if you have, again, abnormalities found on that imaging, but again, it's kind of more intense. You're going to see an orthopedic surgeon, a spine specialist. It's much significant workup than obviously just seeing your normal doctor, because it's a pretty intense surgery. Now, despite all of these increases in the last 10 years, right, some over 600% again, like significant increases, there have been no improvement in patient outcomes or disabilities. So we're right where we were 10 years ago, even though we're spending more money on all of these modalities. That brings us to the opioids, right? Now, opioid medications have been shown in multiple studies that if you do not have cancer pain, and that is pain caused by an active form of cancer, then opioid medications are most likely not ideal for you and can actually cause significant side effects. Recent research shows that chronic opioid use can actually decrease your pain threshold and will cause more pain sensitivity, which is opioid-induced hyperalgesia, which is a fancy way of saying your pain is now worse because you started taking opioid medication, right? And that's the last thing we all want, right? We are going in searching for something because we're in significant pain. We think, oh, this medication will help. But in reality, the more that we're taking, the more tolerant we are becoming, and it's no longer working like it used to. And now we're needing bigger doses, and we're needing to take it more frequently. And hey, doc, I'm still having this pain. And unfortunately, it's because we're now becoming more sensitive to it. The pain medicines aren't working. We're becoming tolerable. We're needing more and more. And that's why we're now in this crisis, this opioid epidemic. An interesting study out of Denmark had 10,000 patients with chronic pain, and they studied looking at long-term opioid treatment. And the researchers found that overall, the patients that took the opioids did not provide relief of pain, did not improve patients' quality of life, and did not improve their ability to function. Well, that goes back to why are we taking these in the first place, right? If it's not helping me, if it's not helping me with my pain, if I can't be as active as I want to be, if I don't have the quality of life that I'm searching for, then what good are they? I need to be looking for something else, right? There has to be something else out there that can help me feel better, decrease my pain, be more active, and live the life that I want. With the opioid medications, we're having significant side effects with them, just with all pharmaceuticals, right? We run the risk of having side effects. But there's also the possibility of misusing or abusing the medication. Now, this is so rampant that you might not even know it's happened, right? And someone can misuse a medication because I might prescribe something and I say you can take one tablet every 6 hours if you need it for your pain. But you're at home, and let's say you think you really, really need it, and you take it every 4 hours, right? Because your pain is that severe, or that pain medicine is no longer working as long as it used to. That is technically a misuse or abuse of that medication. And now you're needing, right, larger doses over time, more pills, and it's just not doing what you thought it would. Because we run this very fine line of using it appropriately and misusing it, right? Because we now know that over time it's not working as well, so now we're needing larger doses and needing them more frequently. We run the risk of actually overdosing on medications that have been prescribed to us, and because of the significant side effects of these opioid medications, one of the severe side effects is death. And it's completely unintentional. You don't actually go out, right, meaning to harm yourself. You're just taking more and more because you're in pain, and because the receptors are no longer working like they used to. You then decide, I can take 3, I can take 4, I can take multiples. And because of the side effects that they happen, because of the side effects of the opioids, it will slow down your breathing, and some people pass away, again, unintentionally, but that happens. Also, by taking these narcotic medications, you may not be learning how best to heal your own body. Because sometimes when we're taking these pharmaceuticals, they kind of block those receptors, right? We're not really getting in tune with what is causing us pain, what is causing that increased inflammation. Is my sleep affecting this? How can I, as a whole person, feel better? And that's because a lot of these medications are masking, right, those symptoms. It's like putting a Band-Aid on. Now, this is a little info on the epidemic that's happening. We are having over 130 deaths per day due to opioids. And 40% of these are prescription opioids that we're getting from the pharmacy. This is 4 times as many as back in 1999, and obviously it is still rising, right? Every year we recalculate, and that number keeps increasing. So that leads us right to where we are, this opioid crisis. About 20 to 30% of patients prescribed these medications misuse them, and then close to 10% actually will go on to develop a use disorder. 80% of people who use heroin were first misusing prescription opioids, because heroin is an opioid. It's an opioid derivative. It comes from the opium flower, and that's what these medications are from. So as the medications stop working and we're needing higher and higher doses more frequently, sometimes it gets to the point where it's just not enough. They'd rather go to the street drug heroin, because it works. It's giving them now that high that they used to get, or that feel good, right? It takes away that pain. It's their escape mechanism. And that's why we're seeing such a rapid increase in the misuse of these medications, because we're needing more and more. And then sometimes we're just reaching that limit and they're going out and getting heroin, because now that's what we need to then take care of the pain when it started down here to begin with. In the Midwestern region, we saw an overdose from opioids increase 70% in 1 year, from July 2016 through September of 2017. So now we're like, okay, that sounds great, doc. I understand, but I still have pain. So what am I going to do about it? What should I do? How can I help? And I will tell you right now, I am very biased, right? I'm an integrative physician, so I think the integrative approach is going to work. And that's what I put my money behind. And so the National Institute of Clinical Excellence, nice, that's a lovely name. It's based out of the UK. They do lots of studies. And they have significant evidence that back and support the treatments for managing chronic pain that include manual therapy, acupuncture, non-steroidal anti-inflammatories like those ibuprofens and Aleve, psychological therapy, and exercise. Now, these are 3 main goals I want us, and you particularly, to work on, right, going towards. Now, I want to encourage you to assume an active role in your care, right? No longer will you sit in the room and just take the medication that you've been given. I want you to say, what can I do? What can I be doing at home? What can I start putting into my body that's going to give me nutrition, right? Help my inflammation. How can I sleep better? How can I work? I want to be part of this team approach, and I'm a very integral part of that team. So I want us to start owning ourselves as the patient, and that's the best foot forward on this wellness journey. Number 2, our goal is definitely to decrease your pain and increase your ability to function, to go about your day with less pain, and then to increase your quality of life, right? I want you to feel better with less pain, doing the things that you want to do that bring you joy and that make you happy. And then at the end of the day, I want us to be sleeping better and waking up feeling refreshed. I mean, that's a beautiful utopia, right? Everyone would live there with me. But that's our goal, right? Number 3, to prevent chronic disability while reducing our need for long-term therapy, such as medications or injections or manipulation. I would love us to find the individual treatment plans, and they're all individualized for you, the patient, what is working for you, So we no longer need maybe medications in the future, or maybe you only need to see your chiropractor once a month, not every week. And then as we continue to improve, it's once every 2 months, right? And then we don't need massage every 3 days because we're having significant back spasms. We're taking care of ourselves and this holistic approach, and now once a month will do me just fine. So we're needing less and less, but we're feeling better and better. So how are we going to do that? A couple different ways. We're going to talk a little bit about external or physical approaches, diet, medication, supplements, internal or emotional, which is very important, and a lot of people maybe will glance over or not really spend a lot of time, but we're seeing the studies are showing how significant, right, these internal or emotional issues, especially surrounding chronic pain, are to our brain, and then it's causing more pain, and then the more pain causes more psychological, emotional issues, but we're going to get into that. And then lastly, reconditioning, strength and support. So let's start with external. External therapies that are going to help are like going to the chiropractor, right, getting those adjustments, seeing the osteopathic physician, getting a little bit of manual therapy. They can do manual manipulation. They can do strain, counter strain. Some physicians like myself will do myofascial release or dry needling. All of these are external therapies we can do to the body on those muscle and skeletal systems that are causing us pain. And again, our plan is, as these continue to work, we need them less and less frequently. Now, last month we talked about the anti-inflammatory diet. So I'm not going to get into it, all the specifics, but it is a key part in decreasing our inflammation, which causes the pain. So a great majority of pain is actually, we see, very closely related to chronic inflammation. So if we're eating an anti-inflammatory diet and leading an anti-inflammatory lifestyle, we're going to have less inflammation and therefore less pain. We're going to be sleeping a little bit better, and we know that if we sleep a little bit better, we're feeling better, our energy is up during the day, it's helping with that stress and cortisol levels, which then help to decrease the pain. So it's in a beautiful circle, and that's what our goals are. But all types of pain are associated with inflammation. Medications and supplements. We've talked already about over-the-counter medications like Tylenol and non-steroidal anti-inflammatories, right? Like Motrin. Naproxen is the generic name for Aleve. You guys might be taking that at home. I've listed some supplements up there. Now, I have not put in details because the details really depend on you, the individual patient, and your provider. So it's very important to be upfront with your provider saying, these are the supplements I've heard about, what do you think? It then depends on how that supplement is made, how it's extracted, as to what dose you need to be taking and what frequency. It also depends on what other medications that you're taking that can start to interact. So all of those are very important factors to consider when starting a supplement. But some of them that we talked about last time, right, decreasing inflammation, your turmeric with black pepper, omega-3 fish oils, ginger, devil's claw, boswellia. For headaches, it's similar, but I'm definitely going to increase my magnesium, my feverfew, butterbur, vitamin B2, all of those. And then fibromyalgia, there's some good studies coming out with magnesium, 5-HTP, and SAMe. Now, internal or emotional, right? This is a very important approach, like I said, that lots of us try not to dwell on. I think it's becoming, maybe some people just don't like to think about it or don't like to talk about it, but our mood and our energy and the way we talk to ourselves in our brain every day are very important to how we realize our day and our pain. So there are very important therapies up here, and we're going to start with cognitive behavioral therapy. We have some practitioners here in our clinic that will help you with this if you guys are interested. If you are not part of the St. Elizabeth's group and you are out in Rochester or wherever, they have therapists and counselors that are trained in these therapies, so please seek them out. I think they will be very beneficial. In a study, after 5 years, patients that underwent cognitive behavioral therapy had less pain, increased physical activity, increased physical quality of life, and overall better general health. They also missed less days of work, right? Because when you're waking up feeling much better and you're not in chronic pain and you can get out of bed feeling good, then you can go to work and be productive and have a good day and come home and it starts all over again, right? But when we're in pain and we're having that significant inflammation and we just can't even get out of bed because it's so severe, that's when we're calling in, right? And we're telling our boss all the time, hey, I can't make it in. Hey, I'm having really significant migraines, or I'm having, this other issue. So this cognitive behavioral therapy showed that, again, we need to be paying attention to these internal factors as well. The second one listed up there is mindfulness-based stress reduction. This is similar to meditation. Mindfulness overall is very important and can help with chronic pain. And it's really going to go after your fear and anxiety of the pain, right? So those of us living with chronic pain tend to think about it a lot, right? We're always thinking about, oh, how is my pain doing today? Or, when we first wake up, oh man, I hope today is not a really painful day. Or, oh, my back's already hurting. We're constantly thinking about our pain. Now, when we are thinking about it, it can give us anxiety, right? It can give us stress and fear that, oh, today is going to be a really bad day and I don't want to, be in a lot of pain. That constant head talk will actually cause us to have more pain. So if we're working on this mindfulness and we're being more mindful of how we're talking constantly in our head, and it's obviously very, very easy to talk about it and difficult to do, and that's why it's a constant practice, okay? But those with a lower mindfulness score had significantly higher pain. And so they're showing that if we work on this and we're more mindful and we are working on the way that we're talking to ourselves and thinking about our own pain, decreasing our anxiety and fear of it, then we have overall less pain. There's also progressive muscle relaxation, biofeedbacks, breathing exercises, guided imagery, self-hypnosis. There are tons of therapies out there to help us with these internal factors that need to be a significant part of your treatment plan if we're having chronic pain. But the most important thing you can do is to be aware of how your mood and your stress affect the pain in your daily life. If we start dealing with them, we're going to have significantly less disability and less chronic pain in the future. Pain and suffering are obviously very closely tied together. We talked a little bit about this. As we have pain, right, in my knee, I'm going to suffer with it in my head, and as I increase my suffering, I'm going to have more pain. So pain and suffering, that's why we have this chart, it's just linear, right? As I have more suffering, I'm going to have more pain. Treatment for pain, right, those medications, the external factors, the manual manipulations, acupuncture, and the treatment for suffering, more of that emotional awareness, right, being more mindful, cognitive behavioral therapy, need to work together. Reconditioning. Now this is a very important part, and we are trying to strengthen our body, right, to get more stability in us, and a part of those, some of those therapies look like physical therapy. It is found that you are going to have more success if you have an individualized plan for you, right, and your pain than a generalized physical therapy plan. And that's why I think it's important to work with a physical therapist. They are a fantastic resource here, and they do great things. They are going to see you, evaluate you, talk to you about your pain, how do you experience your pain, watch you walk, bend, all that good stuff, so they can really pinpoint what is causing your pain, and therefore build an individualized treatment plan for you and your pain. And that's showing that that individualized plan does much better than a generalized one, right? Which makes sense because it's made for you. Yoga. Now, patients that took yoga classes versus standard medical practice were able to do more, be more active with less pain and also with less depression. So that's nice. Yoga is available now in lots of different places. We have yoga classes here at the hospital sometimes, which is I would highly recommend looking into. We have yoga DVDs that you can do them at your own, home. Or it can really just start out with a flexibility or stretching, right? Exercise program at home. Tai Chi is also very good. It is really good, again, for stability and muscle strengthening. The study here that I listed talks about patients with fibromyalgia after 12 weeks in a Tai Chi group reported less pain, fewer depression symptoms, and better sleep than those that did not take it. And then exercise. You can go to a structured fitness class, right? We have fitness gyms all over. They love to put on classes, and there's different types of classes. So if you are a class participant and you like working out with others, I highly recommend those. Some people don't. Some people say, hey, doc, I can't get there. I don't like working out around other people. I don't, anything. So then we have exercise DVDs, right? Programs, even TV channels will show us exercise programs that we can do at home. Very important to do, think about, do I need more flexibility, more stretching classes, yoga, Pilates, or do I need to strengthen my core, right? If I strengthen my core, I'm less likely to actually injure or have lower back pain. Other things that we're going to consider, we talked a little bit, right, about these: depression, anxiety, sleep. If any of these are out of whack, they're going to cause us to have more pain. So these are also very important aspects to be aware of. Obesity and self-care, okay? That is a holistic approach to chronic pain, right? Nice, fast, and dirty, because we're going to take questions. But I am going to have a dry needling therapy lecture in May that is getting a lot of talk because we talk a lot about it in the anti-inflammatory, and we talk about it, how it can help with our pain. So definitely look forward to that in May. I'm going to be discussing more in detail about what is dry needling, how is it different than acupuncture, how can I use it, is it good for me, etc. So all of those questions will be coming, or will be answered in May. I also have a podcast out there called Whole Health Radio. It is co-hosted with Amy Cipolla, who's the clinical pharmacist here at St. Elizabeth's, and she also did the Integrative Medicine fellowship with me. We talk a little bit about integrative medicine, a little bit about functional medicine. We take questions that get emailed or sent in to us, and so people sometimes have questions on supplements, and you might have those same questions, so definitely look forward to that. We also film all of these lectures, and we put them on YouTube, and so if you found this really helpful, and maybe your neighbor couldn't make it, just let them know that it's okay because we're filming it. You'll be able to watch it in a couple weeks. And then if you can't remember what we talked about, you can always go back and rewatch it. So that's nice. Bunch of references. Thank you so much, guys, for coming. Please fill out the evaluation form because I really take note of what you're writing down at the bottom. It will ask for future lecture recommendations. So I listed just a couple of subjects up here, but anything that comes to mind, saying, hey, I really want to know more about this, write it down. And I'd love to continue these lectures every month to make them available for everyone. So thank you guys so much. Have a good morning. And I'm here available for questions.